Hi everyone, I'm Yasmin.
I'm Emily, and welcome back to Doctors Who Wear Pink.
Yes, today we have Dr. Melina here with us. She's absolutely incredible. You might recognize her from her online platform. But we're going to go ahead and have her just introduce herself a little bit.
Hi everyone. My name is Melina. Many of you may know me on social media as Doc or Melina in Medicine, actually, is I guess what I usually go by. I started kind of my social media platform during residency, actually pretty during a pretty dark time when I just kind of wanted to go online and share my story and kind of hear if other people were going through similar things, and it kind of just took off from there. And so I've loved sharing my story and hearing other people's story in medicine on TikTok, on even on Twitter, but mostly on Instagram now. And I'm so glad that you are doing something like this, something I've always wanted to do but never got around to. So I'm so happy you invited me to come on here.
And we're happy to have you on. You talk a lot about like you said, like your life in residency in medicine. But something that I really connected with was kind of a video you shared about your father's philosophy and kind of what separates like a great physician from a master physician. And I was wondering if you could kind of, take our audience through like what the philosophy, really is all about and kind of how to implement that into their own lives.
Yeah, that was a video I posted on a whim and it got a lot of attention. So it was nice that it resonated with people and kind of sparked discussion. So happy to talk about it. Basically, I think the idea is that being a great physician is someone who's like technically competent, right? Like they know the guidelines, they know what the right thing to do, they know how to not harm the patient,
Mhm.
and they're good at their job in that sense. And that's like the obviously the gold standard of what you want to achieve and become. But the way that my dad would explain it to me is that being a master physician is somebody who has like a personal philosophy, like a framework, a mental framework through which they see not only their interactions with their patients, but also interactions with like the staff in the office and the nursing in the hospital, the colleagues that you work with, the co-residents or the med students you work with. And that's something that is built over time and usually from a reflection of like, what are my values? What are my priorities? And it took him, he said, like 20 to 30 years to build it. So I don't
Wow.
anticipate for me as a new attending to have built it quite yet, but I'm starting to kind of think through the types of things that am thinking about to become a master physician. And I think if I were to give advice to people who are in training about where to start in that process, it's, who do I want people to think of me as being when they're not physically in person with me, right? When I send them an email, like what is going to spark to their mind? If I ask them for help, what's going to come to mind for them? How are they going to treat me when no one's watching, type of thing? What are my values and priorities in medicine? Do I view it as a calling or do I view it as a profession? So those are the things that I've started to think about, in my experience.
I love that. I know that during our curriculum, we also talk a lot about the humanistic side of medicine and having
Yeah.
not be just the scientific, but also, like you said, how you talk to patients, how that kind of like translates through your,
Mhm.
is there anything specific in the past like time that you've really honed in on and has made an impact in your patients' lives?
So something that I started doing in fellowship that like kind of took off, and I've also been posting it on social media, is I draw a lot for my patients just because I'm an endocrinologist, and so a lot of the concepts are very foreign to patients. Like most people don't know what an adrenal gland is or like where the thyroid nodules actually are and all of this
Mhm.
stuff. So it's really nice to draw it out for patients and take them through that process. And at first, it was just a way for me to communicate with my patients, but then I realized that they were so thankful that I did that because believe it or not, so many people don't explain things to them. And they were like, wow, thank you so much for sitting and taking the time to explain this to me. And I'm a visual person and this was so helpful. So that's kind of part of now that you brought it up and asked me, I realize maybe that's part of like how I'm building my master physician kind of template over time is the use of drawing and like visual aids.
Kind of what Emily was saying, we're in the transition of like getting into third year soon, towards the
Yeah.
end of our second year. So we're getting all these lectures about like, all the things outside of being able to diagnose, being able to treat, like things to think about. And I'm sitting here, I'm like, man, being a doctor is hard.
I know.
Like, I like there's so many things that there's biases that you need to keep in check. Whether
Mhm.
you mean to have them or not. There's, the system itself and being able to do, a root cause analysis when unfortunately something can go wrong. And it's just like, I'm sitting there and like I said, we're kind of, at the end of our second year, which is our preclinical. So we're in the midst of just like learning all this material
Mhm.
for the first time and now like taking step one and relearning it again. That I'm like, oh wow, this added like
It's
double,
another layer.
triple
Yeah.
layer.
Yeah.
I'm like, wow, like
Totally. Yes,
that's
you'll see
tough.
in clerkships, it's like a whole other level. And also, like, sometimes you just have a bad day, right? Like, I
Yeah.
have bad days as a doctor, you're gonna have bad days as a clerkship student, but the ability to not let that translate to patient care is really hard. Like, subconsciously, sometimes it will happen. And that's like something you need to learn of, like, how do I separate what's going on in my personal life to how I'm like approaching this patient? And that's something I'm still learning. It's really hard. Like even in New York, like I'm in New York right now, and like the snow and like the cold has just
Oh
been like
God.
Oh my.
making everyone super low mood. And like I go to work and I'm just not like my happiest lately, but I try not to translate that into patient care. But of course, like you're only human, you'll realize that when you're on the wards.
Yeah, that's so fair. You've recently, I forget how recently, graduated from your fellowship,
Mhm.
correct? Yeah.
Yes,
How has that, I guess, transition been? I know we kind of touched on it a little bit, but like you're
Mhm.
like you're full on
I know. It's pretty weird. It's really,
yeah,
I feel like I'm playing pretend every day. No,
yeah,
I hope none of my
fair.
patients see this. No, but that's kind of how it is, though. It's really weird. Like I definitely think it's the hardest transition I've had. Like
Mhm.
you always think the next transition is going to be hardest, right? Like you guys are about to enter clerkship, and you're like, that's going to be the hardest transition.
Yeah.
And then you're gonna go into residency, and you're like, no, this is going to be the hardest. And then fellowship, and it just never ends. And then finally, when you reach this like attending life without having that supervision, it's like super, the first few months were super stressful. Like the decisions that I was making 3 weeks before as a fellow that were like second nature, I would make them in a minute. Suddenly I was second guessing everything. I was like, because it was my decision,
Yeah.
nobody else was overlooking me. So I would definitely say it was the hardest transition I've had in my career.
Mhm.
But I'm like 6 months in now. I started in August, a little over 6 months in, and I feel a lot more confident, a lot more competent. And I think getting the feedback from your patients of like, oh, like you're doing a good job. And like, I really am so glad that you're my doctor, that like helps over time.
Do
That's a
you
big part of medicine is the transitions, as you'll see. And like the anxiety around transitions, like I'm so nervous to enter this next phase, and it just never ends until you become an attending, right? But
Yeah, no, amazing. Kind of honestly good to know that, I guess going into it, that feeling is normal and that
yeah.
feeling isn't a sign of like you're not meant to be here. This
Yeah.
isn't right for you. It's just like I think with anything in life, you kind of get those little bit of nerves. And I feel
Mhm.
like I don't know, like maybe once you stop like being surprised by it, it like is a little
It's
bit
just normal.
more manageable.
Yeah.
I haven't thought about that.
Yeah.
Yeah.
But
Do
I
you
think the best med students and residents are the ones that are nervous to transition, right? Like
okay.
if you weren't nervous, it would be like not a good sign, right? So I think
True.
the like knowing that you still have that passion for medicine, that's a sign, is like you're nervous to like, oh, am I going to do a good job? Am I going to impress these people? Am I going to be a good, clerkship student or resident? So that's a good thing, I think. It's just takes getting used to.
Yeah, we'll definitely hold on to that next year. Anytime we're
Yeah.
like freaking out about
Mhm.
something, be like, means we're doing a good job. Means
Yeah,
we should be
exactly,
nervous.
exactly,
Do you
exactly.
feel like people on the outside of becoming a doctor, like, oh, it's so long, like that's so many years. Now that you're at attending, do you feel like
Mhm.
the time went by fast, it went by slow, or like kind of what was that experience like going through it, I guess, like timeline wise?
It felt like the light at the end of the tunnel was going to be far away, honestly, as I'm sure everybody will say. But I'm in my early 30s now, and I feel like I have like my whole life ahead of me still, right? Like I'm getting married, I'm gonna hopefully have kids soon, and my other friends are maybe just a few years ahead of me. And I think that's the hardest part is the comparison part of like
Yeah.
yours as a med student, as a resident, and then you're comparing yourself amongst people who aren't. And that was really hard for me in residency. It's
Mhm.
like, oh my gosh, like they're getting married and I don't even have a boyfriend and I'm like a first year resident, right?
Yeah.
So just having patience and knowing like things are going to happen the way they're supposed to happen. And now I feel like looking back, yes, it was 10 years of my life almost, but
Mhm.
there were so many fun times. Like I felt like I got to actually celebrate more things than I would if I wasn't in medicine, right? Like, because every milestone, every transition, you're celebrate. Like, oh, I just took step one. I'm going to celebrate. I just took step two. I
Yeah.
just matched. Like all of these exciting things that I look at some of my friends who aren't in medicine who their like main events are like promotions or maybe not, and they don't have as those milestones. And so I try to be positive in that sense of like maybe we do have it better in a way, even though we delay our gratification.
Yeah, I really, really like that. I think that is so true. Like we just finished up like our repro exam on Friday and I was like, yay, we passed. Every every little exam, like every little
Yes,
test,
exactly.
it feels like not the biggest thing in the world, but in the moment, it's just like,
Right.
God, like this is a milestone I literally have to hit, or I
Yeah,
will fully be, full stop. So it is kind of fun. That extra stress kind of makes it, I guess, more exciting once you're like
exactly.
over that hump.
Exactly.
Yeah. Well,
But it's a lot of emotions because of that.
yeah,
So,
literally.
yeah, it's a lot of roller coaster.
Yeah. My family's sick of me. Like, I'm always like, I'm so nervous for this exam. They're like, you literally call us right after every time, and you're like,
Yeah.
pass. Like, they're like,
Yeah.
it's okay.
You'll be fine, and then it's always fine, but then it becomes a tradition to like be anxious about the exam. So you have to do it every time, right? Like it's just this whole thing.
Yeah, a whole thing. You mentioned kind of, getting married soon, and
Yeah.
I know you shared kind of your story with your fiance
Mhm.
on your platform, which I love. Like that is like definition of, small world. You literally never
Yes.
know. Um,
Yeah.
if you want to like get into a little bit of that,
Yeah.
that'd be great.
And how the wedding planning is going. I've
Yeah.
Yeah.
been
Oh gosh. Touchy subject. No, it's fine. I'm excited. Um, I guess I should actually start by backing up a little bit because I was in a relationship in residency. I was in a long distance relationship.
Mhm.
I at the time it was like peak COVID because I started residency in the peak of COVID. There was nothing to do socially. And I was in a long distance relationship. That was really tough. But I think in my mind at the time, I was like, okay, like maybe it's better I'm in a long distance relationship because I don't have the time as much and we won't resent each other. And I think
Mhm.
I was like trying to convince myself in a bad relationship that it was, supposed to be that way. And ultimately, we had ended up breaking up right before I started my fellowship. So for 3 years, and then right before I started my fellowship, we broke up. And then like 2 months
God.
later, I met my now fiance. And the story, yes, I've shared it. It's kind of weird. So basically, my fiance is one of my dad's surgery residents. So I knew who he was because of that, but I never met him. And I was on night float in my IM residency one night with one of his friends from college.
Mhm.
And she was like, oh, what are you doing on your night off? Because I had a night off that night and it was around Halloween. And I was like, oh, I'm going to my dad's Halloween party that he throws for the general surgery residents every year. And she's like, oh my gosh, you should totally like meet my friend Kyle. He's a resident there. I'm sure he'll be there. And at the time, I was still in a relationship, but she just wanted to introduce us. So I was like, yeah, sounds good. But he never made it because he was on call, classic
Mhm.
surgery residence.
Yeah.
So we never met, but we had followed each other on Instagram. So we were like quietly following each other's lives for like 2 years after that.
Mhm.
He was in a relationship on and off. I was in a relationship. So I kind of like saw who he was and what he was doing, but never met him.
Yeah.
And then when I became single after my residency was over that summer, we like matched on Hinge. It was really weird. And he asked her, the mutual friend, like, oh, is she single? Is this a catfish? Because I've been following her and it looked like she was in a relationship. And she was like, yeah, I think she actually is single now. And then he messaged me and was like, at the risk of your dad killing me, will you go out for drinks? And the rest is history. Yeah, we went out. I was like, I can't not go out with him now,
Yeah.
because that was pretty ballsy. So I was like, all right, I got to give this guy a chance.
Hmm.
And we were so similar. Like we spoke about everything on our first date, like overshared, like depression in residency and like how
Yeah.
many kids we want. It was so weird. It was so unlike anything I've ever spoken about on a first
Mhm.
date. And it was the first time I started dating someone similar to me. So I didn't realize how important that was. And also like the first time I dated someone in medicine and I didn't realize how
Yeah.
important that was either. And then it kind of just, took off. But yeah,
I love that. It's kind
long
of giving,
story, but
no, it's perfect. It's kind of giving
yeah.
How I Met Your Mother.
Yeah, yeah, exactly.
Yeah,
I know
where
we talk about like telling our kids that story and how it's gonna be funny. Yeah.
it's perfect. I love it.
Wait, a follow-up question. What's it been like for you guys both being in medicine to be together?
Hmm.
Yeah, I get that question all the time because I think I was of the mindset before, like, I'm never dating someone in medicine. Like, I don't want to like be at home with people and like constantly talk about medicine and opposites attract. Like, I always abided by that mentality.
Yeah.
But I can't tell you how nice it is coming home and like being able to vent about something and like talk about mental health and medicine
Mhm.
with them like truly understanding, that's been really, really nice. Um, Not to say it's necessary, right? Like I still see the other side of the coin, but having experienced both dating someone not in medicine and in medicine, I think that for my personality, it just was a better fit. So it's crazy that I went like 30 years never dating someone like similar to me, and then it
Yeah.
just kind of worked out. But yeah,
Well, that's exciting, and I'm happy for you that you met someone so similar and that seems to
thank you.
fill,
Yes.
fill your cup so much. And
Do
yeah.
do your parents tell you to avoid people in medicine, or are you in your mind like I should avoid other people in medicine, or you're open-minded?
Yeah.
Open-minded, I'm gonna say.
Open-minded.
Yeah,
Okay.
I think the person is more important than what they do.
Agreed, agreed, agreed.
So,
No, that's a good point. I've been dating my boyfriend since like senior year of college. So
Nice.
he's kind of like been on this journey with me at points where I didn't even know if I would like end up, getting into medical school and like, really being in medicine. But honestly, I think for me personally, it's been good. But I also think we're very similar outside of medicine.
Yes,
And I
yeah.
think that's what makes it
That's the
work.
most important, probably, for sure.
Yeah. Yeah.
Totally. That's so nice.
Yeah. And how's the wedding planning? Like how,
It's
you're
good.
new attending, you're
I
engaged,
know.
you're planning a wedding, like you got it on
Yeah.
your plate, girl.
I don't recommend doing all at the same time. But that's how life is, I guess. There's no perfect time to do anything, I think, is what I've realized over the years. Like if you're gonna wait for a perfect time to reach something, like it's just never gonna come. So you might as well just
Yeah.
do it.
Yeah.
Um, it's been good. It's like I didn't really mention this earlier, but I never really dreamt about my wedding. Like I didn't grow up thinking about my wedding and like planning it and like the dress and all that stuff. Like I
Hmm.
was just like, I want to be a doctor. Like this is my goal. And
Yeah.
I was very like career focused. And so when this kind of came along, I was like, it's exciting, it's new, but it's also like a lot of work because it's not something I've been planning forever.
Hmm.
But it's good. We're getting married in Greece in July. My family's from there, and it'll be like a fun little destination wedding. It's interesting getting married there because they're really chill about stuff. They're like, I'm like, should we like start on the florals or something? They're like, yeah, it'll be fine. Like, don't worry about it. I'm like, are you sure? Like, because I'm type A, like I'm sure you guys are too. Like everyone in
Yeah.
medicine likes to have a plan.
Yeah.
You want to do everything in advance. And they're like, oh, like we'll do that in like March or something. I'm like, okay.
Okay. And how is
You.
your fiance with all of it? Like, is he more chill or
Yeah.
because, like, I feel like definitely most people in medicine are type A, and I would have to
Yeah.
put myself in that bucket as well. But is
Yeah.
he like the chill, like rock of it all?
He's definitely chill. He is a yes guy. So like what I do is I give him like two options so that I feel like he still has a say. So
Yeah.
he feels like he still has a say, even though like we tend to go with the one that I want. But he's definitely chill. Like he always reminds me, like we were just doing our invitations, which are so stupid, and I hate that word, but they kind of are because everybody throws them out. But it's like something our families wanted us to do, and I was
Yeah.
agonizing, like couldn't sleep at night because of the design. And he just sat me down and was like, Melina, like it doesn't matter. Like you go based on what we want, not on what your parents want us to put there and the design, all that stuff. So he really like puts it in perspective. So I think even though he doesn't do a lot of the work per se, like the mental side of it is really helpful.
Yeah. And that's
Yeah.
super important.
you kind of alluded to this a little bit, but um, in this podcast, we also really like to talk about like the timeline, I guess, of like meeting someone, having kids,
Yeah,
settling down and stuff like that. Is there any like pr you mentioned very well that like there's no perfect time to do
yeah,
anything. Did you ever feel any like pressures from other people or from yourself or have any like advice to our listeners who might kind of be stressed about like finding a partner, thinking about like when
yeah,
they're gonna have kids?
yeah. Of course, it like crosses women in medicine's mind all the time as med students and
Yeah.
residents. It's like natural. Like as much as you want to think like, oh, it doesn't matter to me. Like I'm trying to be a doctor and I'm a boss, like whatever. And you are, but like you still think
Yeah.
about that, inevitably. So of course, it was always in the back of my mind. I think like what I've realized over time though is that who you marry, and if you don't decide to get married, like whoever you spend your life with and decide to do that with is probably the most important decision you'll ever make in your life, or the second most after whatever in your career is. And so that's something that you really want to give a lot of patience to because that's like decades and decades of your life.
Yeah.
And getting married 5 years before because of a timeline that you put in place or because you're comparing yourself to people who aren't in medicine is just not worth that heartache and that mental hurdles that you're going to deal with down the line if you don't marry the person or end up with the person you're supposed to be with.
Mhm.
So hindsight is 2020. Obviously, I didn't think like this always, but now I think like it all works out. It works out the way it's supposed to work out. Um, but dating in residency is definitely hard. And dating in med school is also hard, right? Like you want
Yeah.
to be with someone that supports you, like it sounds like your partner does, and doesn't like resent you for all the time that you spend away from them. And
Oh
that's
yeah.
really hard.
That's a big one.
Yeah. So if you're with someone right now and you're listening to this and they resent you for like studying for a test or, like not going out on a Friday night because you have something to do, like that's not the person you're supposed to be with.
Oh God. Yeah, no, it should be the complete opposite. Should sit next to you
Mhm.
while you're studying or
Mhm.
like buy you your favorite snack and like find a way,
Yes,
like cheer you up
exactly.
during that time. And
Yeah.
I think too, because you brought up the point of just like, it is nice to have someone on the other coin of like being in medicine as well. And I feel like you can sometimes get that through friendships. Like,
True. Yeah.
having friends in medicine, kind of the same thing of like, if your partner doesn't also have other people in their lives and you're like the only person for them, but you can't, fully give your all to that
Yeah.
because, you are in medicine with regardless med school residency
Hmm.
attending. Like, I can imagine that like being really really hard as well. And I think also just like the community that both of you guys decide to surround yourself with also kind of plays a part, which I have realized so much more now that I'm like in med school and I'm like, oh, I'm so thankful that like we both have our own communities that come together at times. It's just great. But like if he wants to go out and like have a fun night and like get dinner with friends or something and I can't, like I'm not the end all be all decision factor.
Right, right,
Like
right.
he has other people, or if I need to like lock in and study, like I have like my friends to like go to the library
Exactly.
instead with kind of, like it's like a give and take. And so I was just thinking about that while you're talking about
Yeah, you have to have like your own lives independently and then bring positivity to each other in like a joint relationship, but you're okay
that.
separately. I think that's really important for a woman in medicine who like wants to grow an independent career is to make sure like that you have that mindset.
Yeah.
Like Kyle's a surgery resident. He works extremely hard, like crazy hours. But when he comes home, like he's done for the day because he's a surgeon. So like it's not like he has to do stuff on his computer after work. Whereas I have like the opposite, like my hours are great, but then sometimes when I'm home, like I have to respond to messages or whatever it is. So we just
Yeah.
lead different lifestyles. And so he always jokes that he comes home and I'm like still at my computer and um but he like leaves me alone, like he knows it's my computer time. He knows it'll stress me out more if I don't do that work like then and there. So
Mhm.
kind of knowing someone who knows like your boundaries and what you need to do to like advance your own career is so important and not holding each other back, because of that.
Yeah. No,
Mhm.
definitely. It's a great point.
Yeah, how
But you should also, what I wanted to say when you were talking is like enjoy med school because I think med school was probably like the four funnest years of my life. Everyone like thinks that med school is like so intense and it definitely is. It definitely
yeah.
is. But I had way more fun in med school than I did in college. That might have just been me and like where I trained
no,
and
that
stuff.
I I feel the same way
Do
so
you
far.
agree?
Yeah, I
Yeah.
agree. And I also like I tell people this all the time. If you say it's stressful and you're tired and like it's
Yeah.
not fun, then that's how it's gonna be. But if you make the
Right.
time to go do fun things, it can
For your
totally
outlet.
be both. So,
Totally. And you're
but
surrounded by people that like are doing the same thing, right? Like I look back on college and I was like a senior. I had to retake my MCAT. So I was like studying
mhm.
on a Friday night and everybody else was out. And like I just like hated it. I was like so resentful, just
Yeah.
like, oh my gosh, I can't believe this is happening to me. And then you're in your med school rather, and like, everybody finished the shelf exam on the same day and you just go
Hmm.
out and celebrate and everybody has similar priorities, and that's so fun that you're never really going to have that again in your life.
I know.
Nor are you going to have like summers off again. So like enjoy
Yeah.
them.
That
I
as
always look
well.
back and I'm like, oh my gosh, like those elementary, middle school, high school summers and college summers, like
Mhm.
those are epic. We just don't have those anymore.
Yeah, no, that's so true. I know it's funny because you even brought up like taking the exams on the same day. For us, that kind of ends with like our second year, and I think we only have like four or five. I haven't like counted.
Mhm.
And we like took one on Friday, and finished the exam. All of our friends are like corralled in like our atrium,
Yeah,
yapping about what we're gonna do that night, what this weekend's gonna look like. And then I was like,
exactly.
wait, guys, I was like, I'm
It's
actually
so
getting kind of
fun.
sad.
I
They're like,
know.
you're sad you're not gonna like you won't be taking these exams anymore. And I was like kind of the whole ritual of it. Like one of my friends that I study with a lot, like we get to the med school like an hour before. We sit on the second floor, we like run through the list of things that we made note of that we just have to like say out loud before we go in. And then it's like everyone like is in front of this one door like five
Mhm.
minutes before the test starts, and then we all just like rush in.
Rusted.
Yeah, and I'm just like, I don't know, like that ritual
Yeah,
of it all is like really, I don't know, that's gonna be something I look back on and I'm like, oh, like that just like, that energy and like everyone talking and like kind of being delusional because you
yeah,
stay all night to
yeah.
see or something and like,
I totally remember those days too.
yeah,
1,000%. I'm like going to the parking lot and then like deciding what we're gonna do. You
literally.
always you always remember those moments, but you're gonna get them in like clerkship years too, because you're gonna have a small cohort that you like go through rotations with, and you're gonna take your surgery clerkship and I mean, shelf on the same day, and you're always gonna find like those little cohorts within the cohort, even
Yeah.
in residency, because a lot of residencies are structured that way of like we go through inpatient together and then we'll do outpatient together, and it's nice. That's what's nice about medicine, is you get to kind of build those relationships with like small groups of people over time.
Yeah. No, I love that. Another thing that you spoke about on your platform that I personally really liked as someone, like we said, for second years, we have not started clerkship or like declared any sort of
Mhm.
specialty. And you kind of use the word like, sustainable specialties, in medicine and making sure it's who fits who you are most days. So
Mhm.
I wonder if you kind of like explain that to our listeners and kind of go more in depth on, what that exactly means and what we should kind of be thinking about in our heads.
Totally. I think it's like something that I've reflected on over the years, and I think you definitely have to be a reflective person going into clerkships to think in this way and like take notes of like important patient encounters that really resonated with you. Not
Mhm.
only because it's going to become helpful when you do your US applications down the line, but also just in general of like, oh, that interaction like really fulfilled me. And sometimes it'll be on a surgery clerkship and sometimes it'll be on something else. But on the whole, like, what do you find? Where do you find that's happening most often? But when I say like sustainability, I think there's a lot of specialties that you might go through in med school that feel like very exciting, right? Like, oh, I just saw a baby being delivered and like I helped deliver a baby, or I just like held something in a surgery, like I held an organ or like a beating heart or something. And that's such an adrenaline filled moment that it's really important to separate that from like, can I do this every day? And do I like the parts outside of that adrenaline filled moment to do it every day?
Yeah.
So that's what I say when I mean like most days. I don't think I would be able to do something like that personally most days. Like I loved kind of going into the OR sometimes, but I could never live there for lack of a better word. So I realized like the more quiet moments of like talking with a team and like thinking through a problem was something that I would be happy to do most days of my life.
Mhm.
Versus something else. And I think that's what you kind of start to reflect on.
What kind of like went into your decision of picking IM and now endocrinology?
Mhm. It's interesting is like my dad's a surgeon right now, my fiance is a surgeon. My family is like background different than I am for sure.
Mhm.
Um, I just like always envisioned I am as being like the doctor's doctor and like knowing all the things. And I will always like admire that and was inspired by that of like someone looking to you and being like, she's a real doctor, even though that's not how it is at all, right? Every doctor is like so smart and like knows everything. But
Yeah.
that's just like the mindset I went into medicine with. And in my pre-clerkship years, like I liked so many different organ systems that I didn't really want to let any of them go, for lack of a better word.
Mm.
Um, And so I liked that. And then I love like the collegiality on the wards that I experienced like in my med school clerkship of
Yeah.
the team-based aspect of it, which you can find in so many specialties, and that's why it's so hard.
Hmm.
Um, but it was just, I don't know, I just felt the most comfortable and the most confident in that setting. And it's hard to describe. It's something that you'll like start to pick up on as you go through. Do you already have your clerkship like schedule yet of how you're rotating?
Due tomorrow.
Oh, tomorrow? Oh no.
Next week we'll have our schedule. So
Okay, nice.
Literally Tuesday, we'll find out what they picked for us out of the lottery.
Nice. I
Yeah.
started I started on medicine actually, and I was so scared because medicine is like so wide, like so
Yeah.
broad, and the shelf is so hard, and I was like, oh no. But it was a really good foundation, and like the expectations were really low, so like they were easy to
Love
meet, you know what
that.
I mean? Because it was your first clerkship.
Yeah.
Um, you'll be able to reason through any of the different, permutations of clerkship that you end up, and it'll be fine.
Mhm.
But yeah, it was just like a good feeling. I thought about peds as well. But then I realized that like loving to interact with kids and then being someone's doctor as a kid
Very
is so
different.
different. Like they don't
Yeah.
really like you that much when you're their doctor. They
No.
don't want to talk to you. It's not all fun and games.
Yeah.
So that kind of dissuaded me. And then it was kind of like a clear decision from there.
Mhm.
But I think that's why a lot of people like medicine is because it's still broad, where if you have like indecisiveness, you can like like kick the can down the road a little bit. And
True.
like,
Yeah.
I like medicine. I don't know what inside of medicine I like. I still
Mhm.
like procedures, like maybe I'll do GI or cardio, or if I don't like it, maybe I'll do rheumatology or something else. Like
Yeah.
you can figure that out, when you're a resident.
Yeah. No, that is very true. I know it's funny you bring up like the rotation schedules. We were just talking about that before you hopped
Yeah.
on
Yeah.
because it's literally due tomorrow and it's so hard because it's like some people are like, "Well, I don't even know what I'm interested in, so I don't even know what
Hmm.
to put in the beginning of the first semester
Right.
if I'm gonna apply to like, audition rotations and if I need to like have an easier second semester to be able to do that." And it's just like
Yeah.
hearing everyone just, we're in an echo chamber of just like swirling
Yeah.
questions and
Yeah.
like what ifs. And yeah, it's definitely like a really like interesting time. But then we talk to the third years who are in it and they're like, guys, doesn't
doesn't
Yeah,
matter.
matter.
exactly, exactly. Like,
We're just like, what do you mean?
you think it's like the most important decision ever. And
Yeah.
it feels like it is. Like we had the same thing, like me and my two roommates at the time in med school. We just like sat on the carpet and we're like we had like post-its and like trying to
No,
like
like
do
you
all
look
these things.
manic, like just
Yeah.
like moving things around.
And it's like, that meme of like Zach Galifianakis from The Hangover, like,
Yes.
with all the equations behind, like that's what it feels like. But
Yes.
ultimately, you're gonna figure it out either way. I
Mhm.
do sometimes think like the order, like perhaps subconsciously, it may influence like your decision on what you end up in, but it's
Yeah.
okay. Like what's meant to be is it will be, and you can always do like auditions or sub-Is and things that you're narrowing things down on. I didn't
You,
think,
yeah, you pushed
yeah.
them and we're like thinking, we're thinking about it.
This is a horrible segue from what we were just talking about, but since burnout is something that kind of gets talked about, and you also alluded to like talking about mental health and stuff on
Mhm.
your platform during
Mhm.
your residency and stuff, is that something you can kind of share more about, kind of
Yeah.
where you're taking that?
I think like burnout as a word and wellness as a word is like such a hot topic in medicine, but like we
Yeah.
never really talk about what it really means. And I think it means different things for different people, honestly. For me, like my story was that I think it was very shaped by the context in which I started residency, which is like the peak of COVID and just not having a
Yeah.
lot of social outlets and seeing a lot more death than I ever expected to see as a doctor. Like I just never thought I would see that much death. And I think that started to kind of weigh on me a lot. And like by the second year of my residency in December of the peak of the winter, it was just not a good time for me. And I think I turned to places like social media and TikTok to like see what other people were doing. And I just decided to like post something one night and kind of just, it was nice because it was kind of like a journal of like what I was experiencing. But for people that don't like post on social media or don't engage with social media, you obviously don't need that, but you do need someone to talk to. And I think it's so important to go to a med school or residency where like psych support systems are already in place. And thankfully, I was able to be connected to a psychiatrist that was like ingrained in our residency program who really only like treated residents. And I found that to be so important because she got it, like she understood what it meant to be a resident and what we were going through. And she was able to give me really specific advice and treat me.
Yeah.
Um, so I think if you're not going to find an outlet, whether it's talking on social media or starting a podcast to vent or whatever it is,
Yeah.
having somebody to talk to, both in medicine, because I think that is important, but also outside of medicine is really important.
You touched on the fact that you are lucky enough to go to a program that kind of recognizes these things and
Yeah.
that is kind of the reality of someone in medicine, especially in residency
Hmm.
during that time. Um,
Hmm.
for us like being, medical students looking forward to, matching somewhere, making that list one day, like how do you like is that something you knew about beforehand? Like how do you I guess find that out about a program, I guess what they
Yeah,
value that's not just like on their website because
I
that's not
know.
something you can really
It's
find.
so hard. It's
Mhm.
so hard, especially now with like the Zoom interviews predominantly too, because I was the last class that interviewed in person.
Oh
So I
yeah.
had the benefit of like seeing the vibe in person. Although I don't think I would have ever predicted that I would like get depression in residency. Like I don't think anyone
Yeah.
like predicts that for themselves. Like I could have never seen it coming. I'm like generally a very happy person,
Mhm.
and even when I was really depressed, I was very high functioning, right? Like we're all very high functioning at baseline. Like we're med students and residents and we're type A, and no one like could see that I was like struggling, and that's the hard part. So I myself couldn't even see it coming. But I think the things to pick up on that aren't on the website of like, you know, when you're interviewing with someone, when you're meeting with the chief residents, just think to yourself, like, if I were to have a really bad day, if I were to have a patient death or something were to happen, like, would I feel comfortable going to their office and like crying or just talking about it, right?
Mhm.
And it seems silly, but you'll have interviews where you'll be like, no, I wouldn't feel confident going into that person's office.
Yeah.
And there'll be others who are like, yeah, totally, like I would feel that way. So those are some things that can help differentiate. But I think even in the Zoom interviews, like the Q&A sessions with the residents, which is more like protected, like they're not going to go and report whatever you say to like the
True.
admin.
Yeah.
I think it's very reasonable to ask questions like that. Like, do you have like access to mental health support? Like, what does that look like? And I think that's probably one of the best things that you can do is ask that question.
Have you made any like specific, I guess in quotes, wellness changes to like your routine or your life now that have really kind
Hmm.
of helped you stay afloat more?
I mean, I try to be really good about my workout routine. Obviously, there are weeks that are harder than others, but I think
Right.
that like
Yeah.
exercise component throughout, because in med school, like you actually have a good amount of time to exercise, and
Hmm.
it's such a good outlet. And then when you hit residency, it becomes a little bit harder. But I think sticking to that, even if it's like once or twice a week, and just knowing that you're going to move your body and you feel so much better after, I think has really helped me. At the time, like therapy also helped, but I've since have fallen off with that, even though I really shouldn't have. Um, in a way, like Kyle has become my therapist, and I don't recommend that. I don't think like you should bring therapy home,
Mhm.
but it's kind of nice when you're in a partnership with someone and you live with someone that you can share with. Because when I was a resident, I lived in a studio like by myself. It
Mhm.
wasn't like med school where I don't know if you guys are roommates, but it wasn't like I had roommates in med school.
Yeah.
That vibe was so nice. And then residency, I like suddenly was living alone. It was just different. So I don't know where I was going with this, but
No,
yeah,
I get that.
yeah.
Yeah.
It is good to have like community, I think.
Hmm.
Um, Even in times where, things are really hard for us, like you kind of tend to isolate. Like it's so much
Yeah.
easier to just like be by yourself. And I think also being, a woman in medicine who sees themselves as very, strong and,
Hmm.
bold and, feels like they can get through these obstacles. Sometimes even for myself, I'm like, well, I don't want to burden someone else
Hmm.
by like sharing even a little bit or just
Yeah.
like being perceived of having any sort of like weakness of, whatever's going on. Or it's like, I don't want to share this. And then, that minimizes what someone else might be going through. And then
Hmm.
they're kind of like, oh, well, I'm going through this as well. And then you're just like, oh man, like I wasn't there for you. Like you know what I'm saying?
Yeah,
Like it
yeah.
kind of gets hard if you don't have those people that you can just naturally have those conversations with and like feel comfortable enough to like talk to them and know that that's like all those things and those reasons why you may not bring stuff up to like your family, like, other people around you like are not true. Like those are just lies that you're telling yourself.
Hmm. But to that point too, like I always thought like that too, of
Yeah.
like, oh, I don't want to burn someone or like maybe I'm not
Yeah.
going to be there for them. But
Yeah.
that's like a bad cycle to get into that I often catch myself into because then you're never going to talk to anyone, right? If you feel that way. That's
Yeah.
like who we are as pe women in medicine. We're like empaths, like especially women in medicine are just like these huge empaths, and we're constantly giving, 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 and expecting like we're constantly helping other people, but then not expecting anyone to help us in return. And sometimes you just have to let someone help you. That's what I've
Yeah.
I've learned. Whether it's someone like sending emails for you or scheduling people for you. Like for
Mhm.
example, like for the first time in my life, I have a wonderful nurse and a wonderful like administrative secretary who can schedule patients for me and like call patients back with their results. And even then, like I still have this guilt of like, should I really have them do this? Even though it's their job, right? Like they're there to
Yeah.
help me.
Yeah.
It's just something that you have to get comfortable like delegating that responsibility without feeling guilty.
I feel like you brought up like a million good points like throughout this whole episode. Like it's funny coming from like someone that is a viewer and has like watched your content like honestly for a while now. So it's like
Yeah,
cool to get like more of the
yeah,
context behind like some of the
yeah.
videos and stuff. I was wondering if like, anything you haven't, had a chance to bring up or like if you have any like hot takes in medicine that, you feel passionate about. You're like, I actually can go on a 30-minute rant about this.
Yeah.
Totally fine if not, but
Yeah, I feel like the old wise woman in medicine at this point because I do have a lot of followers that were like with me right from when I was in residency and they like
yeah.
watched all these transitions in my life and I'm just like old and boring now. But I try to like talk about my past a lot to keep things relevant. But my hot take in medicine, I guess, is that because for example, I have a cousin who one of you know, who's applying to medicine right now. And I never pressured her to go into medicine. I was like always very upfront with her. Like she knew how much I struggled in residency with my mental health and everything. And so I just was like, you're going to make this decision on your own. With that being said, like I told her and I tell everybody this, like I do think that when you're applying to go into medicine and deciding it, you should view medicine as a calling. But then when you're in medicine, when you're a doctor, like where I'm at now, you should view it as a profession. And I think that's a hot take because historically people have viewed medicine as a calling forever for like your whole lifetime. Like you just give your life to the profession and you have no boundaries between work and home. You give everything to your patients. And I think that's just not sustainable. So I think if we really start to view our doctor lives as jobs, because really that's what they are. I mean, it really is just a job at the end of the day. I think that's the only way in our current system, the way it is right now, that we can like last as women in medicine, like throughout an entire career.
Yeah.
So something I'm trying to do is view it as more of a job. Like, okay, I'm clocking out, like I'll deal with that tomorrow, which people do every day in other professions, but we just tend to not do it as much in ours. So
Yeah. No, I really like that. Definitely goes back to kind of like the burnout of it all.
mhm.
Like, you
Yeah,
have to have those boundaries or you're just gonna give everything that you have and
exactly.
you're just gonna
Exactly.
get
But to get there, you have to view it as a calling because otherwise,
that.
like if you're going to do it just for the money or just for the prestige, like that's going to get old after a while,
You'll be so disappointed.
Yeah. A lot of people like the idea of becoming a doctor, but like being a doctor is just way different. It's not like the golden shiny thing that it used to be or that we think it is. And I love my job. I always talk about that on my platform. Like I wouldn't want to do anything else. I'm not one of those like cynical people in medicine yet. I hope I never get there.
Yeah.
Um, and I love it, but like you just need to know what you're getting into. And I think once you get there, like I said, just view it as a job, view it as your profession and kind of go from there.
And kind of like what people say for like surgery. Like if you can
Yeah.
see yourself doing like anything else, then go for it. But if you can, like kind of go towards that. Like just pull on that string a little bit and see where that leads you. And if
Yeah.
it leads you right back to wanting to go into medicine, that's totally fine.
Right.
But just
Right.
like consider, because like I was saying, I'm like, man, there's so much stuff that we have to think about.
Yeah.
Yeah.
Maybe it's because our lectures were like back to back that week, and I was like,
Yeah.
holy cow. But there's a lot. There's a lot.
Don't worry, it's not like when you're seeing patients, you're like, oh my God, that ethical principle. Like, you're not like
That's
thinking about
true.
that
That's
real
good.
time.
Yeah,
Um,
thankfully.
Well, this
yeah.
past week we had like our fake patient encounters
Oh,
just to
great.
practice. And this past week we had like the challenging patient. So you like walk in
Oh,
the door, the patient's like yelling at you,
Or they're flirting with
or
you.
they're flirting
yeah.
with you.
Yeah.
Oh,
So
yeah. Yeah.
I'll be honest, I walked in the room, this man starts yelling at me and I started laughing. And I was like,
Oh,
all
no.
right, okay, so I'm done.
It's hard because you know what's
Listen,
happening. Like you
yeah, exactly. That's
Couldn't
not
do
how it
it,
actually
couldn't
is.
buy into it. I was like, I'm done, I
Yeah.
failed. I think it's over.
Yeah.
so it's like the week before our exam, and you're just like, I have nothing left
No,
to give.
just
Nothing left to give. Exactly. Exactly.
Oh,
But
that,
those are the things that are much easier picked up like by being on the clerkships. And you will have challenging patients and you'll learn how to deal with them and you'll just take it as it comes. But
mhm.
yeah.
which is fair. Well, I
That's
think
so
that's
funny.
kind of all the questions that we have.
Okay.
I don't know. Do you have anything else?
No, I honestly am like letting all this sink in because I feel like there were so many things we wanted to ask you and
Mhm.
that you obviously answered and very
Yeah.
insightful, especially just like
Good.
about being a resident to attending. And then also, I think like very important for our listeners and the whole women in medicine
Mhm.
about, finding your fiance
Mhm.
in your fellowship and just kind of like how that path unfolds for you. So,
Mhm.
yeah,
Yeah.
very grateful that we could have you on
Of
too because we know you
course.
have a strong following and we hope to be one day.
Thank you so
Yeah.
much for having me. It's so nice that you're doing what you're doing and just keep doing it and like it'll evolve over time, I'm sure, and it'll be interesting to see how that goes and definitely can't wait to share the episode with everybody. Even though people probably already know all these stories about me, but I definitely went into more depth and
Yeah.
I'm glad that you brought that out of me. So thanks for having me.
Of course. And thank you so much for coming on. Like this is
Yeah.
always so fun to get to talk to people and like
Yeah.
I think like more conversations, especially with women in medicine, like which
Yeah.
we have our platform, like needs to be risen to the surface to kind of, calm down all the other myths that
The
are put out
noise.
there.
It's a lot
The
of noise. Yeah.
noise. Yeah, the
Yeah.
noise. But we appreciate you having
Of course.
coming on and taking the time to. I hope you enjoy the rest of your day.
Thank
And for
you.
our listeners, I hope you enjoyed this episode, and we'll catch you in the next one.
Bye, everyone.